Now, I promised a little earlier that I would tell you how we did the treatments back in the 1918-1919 flu, and I'd like to tell you how Luella Daub did her work with the swine flu.
Hello, I'm Valerie Schreiber from Uchee Pines Institute in Alabama, where Dr. Agatha Thrash is our head medical director. And today we're going to talk about hydrotherapy. Now that sounds like a really big word, but hydro simply means water. And it's going to be us showing you how to do incredible water treatments that get incredible results. And the beauty about this treatment is it doesn't really cost anything unless you have city water bills to pay. But really it is the most classic treatment we're going to show you that does various things, but especially was used during the 1918 Spanish flu. It was used in a special town, and a doctor did this and a nurse did these treatments on people that came down with the flu, and nobody died. Now that's fabulous results. And so as we start showing you about this and telling you a little bit more, you'll see why it worked. It's the most non-toxic way of treating a person, moving blood from one area to another area, bringing nourishment into the affected area, and it'll heal. So now I want to just kind of tell you how it works. And I tell this to my patients when I'm giving them the treatment, because if your mind can connect in and you can see how this is working in the body, then you will believe in it. You will have faith in the way that it will work and bring healing to you. And when you really connect with it and you believe that, then your healing will be even much more quicker and much more tremendous. I don't want you to have a doubt in your mind when we finish this treatment. Is water, will that really work? You know, I don't want you to have that. I want you to be absolutely clear that this is going to work and you're going to be healed if you use this treatment. Now, what it does is we're going to apply heat to the body, and I'll go over this again as we're working on a patient. We apply heat to the body. Now what heat does when we apply it to the body, it dilates the blood vessels. Now, you know, they're not this big, but just to give you an example, about 40%. And what happens then, it starts to pull inner congestion to the surface. And it also, at the same time, is bringing good blood supply to the affected, diseased area. And then what we do is we do that for 3 minutes, and then we apply cold. And what cold does is it constricts the blood vessels. And so now all these impurities that have been pulled to the surface are going to now circulate back through the body, through the cleansing organs, which are your kidneys, your liver, and your lungs. And even though we're working on lungs that have been infected with a flu virus or pneumonia or bronchitis or various different types of lung conditions, it now allows the lungs itself to clean out what's going on in there. So it's a wonderful thing. And so it's a pumping action. We're just circulating blood, bringing in good healthy nutrients, bringing in a lot of the white blood cells, which we know fight disease. And it elevates the immune system, and you can't help but get well. That's the beauty about it. You can't help but get well. Now, if you can see it, remember, we dilate the blood vessels, and it's going to pull what? Congestion that are in the lungs to the surface, at the same time bringing in good, healthy blood with nutrients in it, the white blood cells in it. And now we're going to constrict it, and now it's going to take that old congested blood, carry it back through all the cleansing organs of the body. Then we're going to apply another heat, and now it's going to pull good, healthy blood, oxygenated blood as well, which, let me just stop right here. When you have pain in any part of your body, that is a first sign that you've got low oxygen. So you've got congested. You know when you swell up, you have a lot of lymph fluid, that's congestion going on. Well, blood can get congested and stagnant in an area where there's disease happening. What we want to do is move it out, not let it just stay there, because then you get sicker for a longer period of time. But as soon as we can move this diseased blood out of the area and bring in, what did I just say? Good oxygenated blood with lots of nutrition, lots of white blood cells, it can't help but heal. And I know you can see that right now, just what I'm saying. So now we're going to go on to show you how to set this up. If you were in your home, or you were somewhere and someone got sick and you wanted to help them, I'm going to show you how you would make it. You would do this obviously in a bed. However, you can do it on the dining room table if you'd like. You can do it on the floor. Wherever it's convenient for you to work, this is the way to do it. Now, if you do it in the bed, one thing that you want to do is you want to put a piece of plastic. Now, this is a shower curtain that I got at the dollar store for just $1. Or you can get a garbage bag, and you can cut a garbage bag and put a garbage bag underneath the sheet in the bed. And this protects your bed from getting soaking wet, because we're going to be using water here and it would go through to your mattress. So you want to, very first is protect your sheet. So you can get a shower curtain liner is what I use, or you can use a garbage bag. Then we're going to put the sheet on, put the pillow on. Let me just lay this right here. Put that there. And we're going to have a bucket full of water for her feet to go in. We're going to have extra hot water in a container that we will use to pour in beside her feet as it is required, because we want to keep her feet nice and warm throughout this treatment. Now, I've been heating up the fomentation pads in the microwave, and now I'm going to get one of them here, take it out of the plastic bag, and here is the blanket that we're going to use to wrap this hot fomentation in. Wrap it over this way. And now we're going to put this down her spine, and it'll be all ready for her when she gets on this bed. Now, this is a real important part of the treatment in terms of you want to be very careful, because when the body lays against this and is trapped by the bed, it has a tendency to get hotter much faster, and it can burn a little bit. So we want to be sure that we have enough blankets. I usually triple the towel up here so that it's, and then I take another towel. I'm real cautious with this, but I'll show you how we treat it if it does burn a little bit, or start to burn. We don't want to burn, we want to, if it starts to burn. So then we make sure it's covered real good and has enough thickness for her. Now I'm going to ask Helena, who's been my colleague here at Uchee Pines for many years. We've traveled together to Romania. She's a jack of all trades, but she happens to be a teacher at here, and plus works in our office. So she's going to be my patient today. And now, as you see, we have the pillow to go under her knees, because we want to take the strain off her back. And we're going to take her feet and we're going to put them in the hot water. Now, the hot water, when we start to put her feet down in the hot water, we want to not just drop her feet in the hot water. We want to make sure that she can tolerate the heat that we have. So I just start to put her feet down in, and I put some of the hot water over top of the feet to be sure. Now, is that good, Helena? That feels comfortable? Okay. So now we go ahead and drop them on down in. Here is a little wood. I don't know what you call it. It's a piece of wood. I don't know exactly what to call this. But anyway, this covers over the bucket. This is made out of just a thin piece of plywood. This right here is an insulation that you can go to Lowe's and buy. It has a split already in it that you put over pipes. And so I put it here just in case she were to move her legs or whatever and she were to hit this. And so you can see now when I cover her up, cover this up, it's over there and it's laying there and it won't drop in. So you can make these things up yourself, especially if you want to have a nice kit prepared so that you can help people at any time, any place. These are some of the things that you'll want to do.